Great. Can you hear me okay?
Yes, we can hear you great. And before you get started, just a reminder, can everyone make sure that they mute their lines? And if you are not a panelist or the moderator, we ask that you turn your video off. Thank you so much.
Okay, great. Well, hello, everybody, and welcome to ASTHO's Ask the Experts virtual session on JUULs in schools. My name is Marcus Plush. I'm the Chief Medical Officer at ASTHO, and I'll be moderating the panel discussion today. For those of you who don't know about us, ASTHO stands for the Association of State and Territorial Health Officials. We're the nonprofit organization that represents public health agencies in the United States and its territories, freely associated states, and the District of Columbia. We represent, across all of those areas, we represent almost 100,000 public health professionals and 59 agencies that employ them. ASTHO's primary function is to serve as an advocate and voice for state and territorial public health agencies to develop public health leadership at the executive level and to provide capacity building and technical assistance to state and territorial health agencies. This Ask the Experts virtual session is brought to you by ASTHO's Chronic Disease Prevention Team as part of our Tobacco Prevention and Control Library of Resources. Today's Ask the Experts virtual session is going to provide a platform for engaging in conversations around reducing the use of JUUL in our schools. And you'll hear from an interdisciplinary panel of experts to discuss some of the interventions to prevent youth access to JUUL, some of the specific youth cessation interventions, and some of the effective policy language and implementation that will be important in these approaches. I'm going to introduce our panelists shortly, but we really do hope we have a very diverse group of panelists who are very esteemed in their different positions, and we hope that you'll really be able to benefit from their different areas of expertise and perspective. They'll offer ideas of how to implement your work internally across programs and also with your partners, and they'll be paying special attention to the role of school districts and state health departments. So at this point now, I'm going to go ahead and introduce our panelists, who I think you'll be able to see on the screen. You'll see a slide with each panelist's name and bio as I'm introducing them. I'm going to start with Sally Herndon, who is from North Carolina's Tobacco Prevention and Control Program. Many of you know Sally Herndon. She's been involved in public health work both in North Carolina and nationally for many years now. She started in North Carolina, where she's probably best known in 1991. I actually will say I had the pleasure to work with Sally for about 6 years in the early 2000s. And Sally manages the Tobacco Prevention and Control branch and coordinates the state's evidence-based tobacco prevention and control programs. For those of you who know Sally, she has many achievements in tobacco control, but perhaps one of her most notable is helping build support for a 2010 law in North Carolina that made all North Carolina restaurants and bars smoke-free. And she then worked with state and local partners to implement the law. And for those of you who know tobacco control and who know the tobacco industry, implementing a law like that in North Carolina definitely. And I'm going to pause here and make sure everybody's got their phone on mute, because I could hear somebody yelling back there. So please mute your phones if you're not speaking. I'll continue now with my introduction to Sally. Sally is past chair of the Tobacco Control Network, which is a network that convenes tobacco control leaders from across the nation. Prior to being in North Carolina, Sally worked for 6 years in the Maine Department of Health and Health Promotion and Disease Prevention. Sally got her education and training from the University of North Carolina at Chapel Hill, both her bachelor's in psychology and physiology and an MPH from the Department of Health Behavior at UNC. Sally is part of the leadership team of the Duke UNC Certified Tobacco Treatment Specialist Program, which is a nationally accredited program that many of you are probably familiar with. And her ongoing work involves working with state, regional, and local partners to reduce tobacco use by young people, eliminate exposure to secondhand smoke, promote evidence-based tobacco treatment, and eliminate tobacco attributable health disparities. So we're very, very, very pleased to have Sally Herndon on the call and speaking to us today, and you'll hear more about her later, from her later. The second person I'd like to introduce is Dr. Bonnie Halpern Felcher, who is a PhD professor in the Division of Adolescent Medicine at the Department of Pediatrics at Stanford University. Dr. Halpern Felcher is a well-known developmental psychologist who's also had additional training in adolescent and young adult health, and who's done extensive research focused on social, environmental, cognitive, and psychosocial factors involved in health-related decision-making and involved in perceptions of risk and vulnerability. He's also very knowledgeable about health communication and general human risk behavior. Dr. Halpern Felcher has been funded by the National Institute of Health and many other foundations, and her research has brought the field a better understanding of how we can reduce adolescent tobacco use, alcohol and marijuana use, and other risky behaviors, including risky sexual behaviors. She's a core member of the UCSF Center for Tobacco Control Research and Education, a co-project leader of the NIH and FDA-funded UCSF Tobacco Center for Regulatory Science, and a co-PI of the new UC Merced Cannabis and Nicotine Policy Center. She has authored over 100 publications in peer-reviewed journals and has been instrumental in setting policy at the local, state, and national level. In that vein, she has worked as a consultant in a number of community-based adolescent health promotion programs, has been active on a number of national campaigns to better understand and reduce adolescent risk behavior. She's also served on 6 Institute of Medicine committees and contributed to 3 of the Surgeon General reports, all of which are focused on reducing adolescent risk behavior and promoting health. And finally, she's the founder and executive director of the Stanford Tobacco Prevention Toolkit. So that's Dr. Halpern Felcher, and now I'd like to introduce Haley Kistner. Haley is a recent graduate from Hutchinson High School in Hutchinson, Kansas. And so she'll be bringing us the perspective of a student who's been in a school and has experienced some of the challenges around JUULs. And she will be finishing, she has finished now at Hutchinson High School and is about to start as an incoming freshman at Emporia State University in Emporia, Kansas, where she'll be studying elementary education. Haley was very school days and has spent over the last 5 years has been very active at the local, state, and national level. Recently, she was named the Taking Down Tobacco Trainer of the Year by the Campaign for Tobacco-Free Kids for her work in tobacco and e-cigarette prevention among her peers. In 2018, Haley was also identified as the National Youth Ambassador for Kansas by the Campaign for Tobacco-Free Kids. Haley has been very, very productive in this work. She's contributed to several policy changes in her community, like getting smoking areas of the Kansas State Fair and getting cigarettes included in her city's clean indoor ordinance. For the past 3 years, Haley's also been the president and intern at Resist, Kansas's Tobacco Prevention Youth Council, where she most recently worked on a back-to-school campaign calling Keeping JUULs Out of Schools. And then finally, I'm really pleased to introduce Rick Krause, who comes from the Hutchinson Public School System. Rick's bio that I have is very brief, so I'm afraid my introduction of him is going to be very brief as well. But as you hear about his long-standing tenure working in public education, he's been working in public education for 30 years. The last 15 years as the Human Resources Director at Hutchinson County Public Schools. And during that 15 years, he's also served as the district's assistant superintendent. So he has a long-standing career in public education, is very, in his leadership roles in schools, I think is very, has a lot of experience and understanding of this current issue we're talking about. And just a little more background, he began his career as a high school math teacher in Emporia, Kansas, and stayed there for 5 years. And then when he moved up into Hutchinson, he taught math for a year before becoming assistant principal at Hutchinson High. And he was a assistant principal at Hutchinson High School until he moved to the central office to begin his tenure in as the Human Resources Director. So that's a little bit about all four of our panelists, and we're really grateful for them taking the time to join us, and we're looking forward to hearing them. So now let me just give you a couple of housekeeping notes before we get started. All of your lines have been muted for the duration of the event. So most of this call is really going to be focused on hearing from our panelists and hearing some of their responses to some of the questions that you all have raised. However, if you have questions or comments during the course of the presentation, you can use the chat box feature on Zoom to post those questions and comments as the conversation unfolds, and we'll be monitoring that carefully, either to look at ways that we or the panelists might be able to incorporate your questions into their comments, or if we're not able to do that, we'll try to look at those and respond after the call to those that we can. I'll also mention that we will be recording this session. We'll be posting the recording a few weeks after we finish with this event. So it'll be there for you to review later if you're interested in doing that. Again, today's discussion will center around JUULs in schools, and we're going to start by diving into how schools are addressing the use of JUUL on their properties. So I'm going to start off, we're going to start off having some discussion with our panelists, talking a little bit about the introduction of JUUL into schools and its journey into classrooms. Basically an overview of this topic. And I'm going to start by addressing the first question to Rick, who has a lot of experience with this from being in the schools. And so Rick, I was wondering if you could briefly tell us a little bit about what you've seen as far as JUUL being used in school settings, and what kind of strategies you've tried to address the use of JUUL in the schools that you oversee.
Okay, thanks, Marcus. First, I guess I just want to make sure that people understand that 1 year ago, JUUL to me was a gem you wore on your finger when you got married. I didn't really know Haley Kisner. I received an email from our local health department introducing her to me and asking for the opportunity to listen to a presentation that she had and give her an opportunity to start connecting to other people in our area to spread the message. And so we are really in our initial stage of figuring out what does this look like at the school level. Haley's done a really nice job in the past year of education. Now we're talking about adults, we're talking about students, we're talking about community. And so we're not in a position yet to talk much about what the data says regarding suspensions, expulsion strategies that may or may not be successful. What I do know is that JUUL is just the latest in a long line of distractions that students have faced, whether it's marijuana, K2, alcohol. It's just simply the newest opportunity for us to begin working as adults to help our kids make better choices. And so at this stage, really what we're doing is trying to figure out how do we help our adults recognize that this is an issue, help them understand the negative impact JUULs can have, and then begin working with our students so at the student level, they can advocate for themselves and for each other to make better choices about what JUULs do to their bodies over the course of time beyond what might be the moment of entertainment.
That's great. Thank you, Rick. And Haley, you've had some experience with this as a peer. Can you tell us a little bit about what you've seen and what kind of strategies you've seen? What kind of use of JUUL you've seen in schools, and then what kind of strategies you've either seen or you think might be effective as we work in schools?
Yeah. So like as a student, I definitely have a unique perspective because I see JUUL usage across social media or on my campus. I would say that kind of the most popular places that I've seen it across campus is just in our parking lot, in bathrooms, locker rooms, and then in classrooms. And I was kind of looking at those locations and kind of seeing what common ground there was. And I noticed that a lot of, in those locations, there's a lot of downtime. And I kind of realized that a lot of the downtime that I think kids have in these types of like parking lot, whether you're going out to lunch, whether you're, coming from classroom to classroom, or just in locker rooms when you're kind of ready to go into different types of sports or activities, that that type of downtime is really where we saw the increase of JUUL usage. And so that was I would kind of say that was what I've seen the most, and kind of the places that I've seen it be the most popular used. As for kind of the strategies that we've used, we've just mostly focused on not any type of policy change. We really didn't want to push any type of policy, but rather we kind of just wanted to focus on educating and informing. And we kind of had 3 different audiences that we wanted to do that, those being parents, teachers, our staff members, as well as building principals, and then parents. And so those types of people were the people that we really wanted to target our message to, and really focus, this past year on just educating them about this product and hopefully providing them with some resources that they can use to help their students.
That's great. Thank you. So that's a little overview of what we're seeing going on in the schools. you know, the next big issue for us is how we get a handle on the extent of the problem and how we measure what's going on. So I'm going to start with Sally Herndon on this next question. Sally, can you talk to us a little bit about how we measure this problem with data and what the role is of public health to support school administrators in identifying and implementing effective strategies?
Yes, thanks, Marcus. It's great to be on this call and learn from all of the different perspectives. In terms of data, the 2018 National Youth Tobacco Survey data really finds that there's a huge cause for concern in the country. There was an alarming increase with e-cigarette use between 2017 and 2018. In fact, 1.5 million more students used e-cigarettes in 2018 versus 2017, according to the National Survey. That's a 78% increase in 1 year among high school students and a 48% increase among middle school students. North Carolina was fortunate to run our own North Carolina Youth Tobacco Survey. We will be in the field this fall as the fall semester opens, and we are concerned that we will find an even bigger jump given the trends that are happening now. We have done some innovative things in North Carolina to try to get a little better handle on this problem. We learned from a presentation that was done from the Tobacco Control Legal Consortium and the AG's office in Arizona that looking at national data, kids across the country were really underestimating the amount of nicotine that was in these products. And so they, in Arizona and now in North Carolina, we have sent confiscated e-cigarettes to our public health lab and analyzed the results. And in both states, we found that there were much higher levels of nicotine in the e-cigarettes that kids were using than what the perception was. In both states, JUULs were the predominant cigarette that was being used, and there was some variability in the nicotine levels even against what is on the package, indicating that even though they're supposed to be a closed system, there may be kids who are putting in their own e-liquids and changing the level of nicotine in the cigarettes. Or perhaps since they're not fully regulated yet, there may be differences. This little study, I think, got the attention of CDC, and coming soon will be a publication of a study that took a little bit deeper dive into USB type e-cigarettes. We did this in North Carolina as well as it was done in California by the Epidemiologic Intelligence Service at CDC. And there we did in-depth interviews. We did surveys of school personnel in randomly selected of the states. We did environmental scans, much like Helen was talking about, looking at what's going on in the bathrooms, what's going on in the parking lots, what kinds of things are being disposed of in schools with e-liquid. And those studies will be written up and published soon, giving us a lot of information to help us advise faculty members about how to work with this problem and help reduce the problem of e-cigarette use in schools.
Great, thank you very much, Sally. I just wanted to pause here and just remind or ask everybody to double check that if you're not one of the speakers, that you can please mute your phone, because we are getting quite a bit of background noise, and I know that's distracting for folks. So if you could just please double check on that, that would be very, very helpful. So that was a little bit of some very nice review of some of the ways that we measure issues like electronic cigarette use in schools. Before we move on, I did want to just see if anybody else had anything to add on this issue of measurement and how we kind of track the data on a situation like this. Particularly, I didn't know if Dr. Halpern and Felcher might have any further comments on this, or any of the other speakers. I just open it up for a couple seconds here if anybody else wants to comment.
Sure, thank you. Hi, everyone. This is Bonnie Halpern Felcher. I'm excited to be on with everybody, and thank you for listening. Just a couple of quick notes, and in fact, I think it came through on the chat. Absolutely. JUUL, in terms of measures or understanding the data, while there are other vaping and particularly pod-based products, JUUL still currently holds about 75 to 80% of the market share. So JUUL still is the #1 e-cigarette used on the market, but it is important for everybody on the call and the webinar to note that there are other products like something called Smoke, SMOK, that in our lab we're starting to see an increase in use of that product, My Blue. There are a lot of other pod-based and newer e-cigarette products that youth are using. So just to be aware of what they look like and I'll show you a little more about the toolkit later or mention it, but keep up with any of the data that you can find on that information, because I think it's important for everybody to stay current. The other thing that you may have heard, and I get a lot of pushback on this, is from the pro-vaping people isn't it important and great that we have e-cigarettes? Because of e-cigarettes, we don't have kids using cigarettes. And that's important to note that that's not at all true. The national data clearly show that cigarette use declined at least a couple years, if not a decade, before e-cigarette use increased. So I just want to make that clear that people don't fall into that trap of thinking that e-cigarettes actually reduce cigarette use. It's more the opposite, that youth are initiating with e-cigarettes and then sometimes moving on to other tobacco products, including cigarettes. Thank you.
Great, thank you, excellent, thanks very much. I think that is a very common refrain that we hear, particularly from the industry, and one that it's very important that we're clear on the facts about whether that's true or not. Just a little more delving into this topic, and maybe Rick, I'll let you take a first shot at this question. One of the nice areas of overlap between public health and public school systems is in the role and presence of school health nurses. Every state and school district tends to handle how school health nurses are employed and where they're centered differently, but they are a nice crossover between education and the culture of education, and health and the culture of health. So I was wondering if you could just talk a little bit, Rick, about what you see as the role of school nurses in addressing JUUL in schools.
Absolutely. School nurses are an integral part of the school system for a lot of our kids. For many of our students, they are our first line of contact because that's where the relationship lies. And that gives nurses a great deal of opportunity to provide a positive influence on students, whether it's JUULs or tobacco or drugs or alcohol or whatever else may be going on in their lives. Nurses become a front line of defense. And as Haley has talked about the education of all of the entities that surround JUULs, nurses are a part of that. And it's important that they understand, not just from a health standpoint because they're school nurses, but from the impact of students who come to them with challenges that, the JUUL may just be the coping mechanism. It may be a food insecurity at their home. It could be a prior childhood trauma or other issues that have driven students to find some method, and the current method might be JUUL. And the nurse becomes that social worker, school counselor, perhaps positive adult in their life that gives them the opportunity to talk about the issues they're facing, of which JUUL has become a negative part.
Great, thanks. Yeah, that's great to hear that they're playing such an important role with this, and I think there's a lot of opportunity there. We're going to just transition into a little bit more discussion about, what is the risk or concern about JUUL use in children and adolescents? And one of the big concerns is what are the potential effects of JUUL on adolescent brains and adolescent brain development? So what I'd like to do is we're going to start with this next question with Dr. Halpern Felcher. Can you tell us a little bit about what is the evidence on the harms of JUUL in specific and electronic cigarettes and really, I guess, ultimately nicotine? So what's the direct harm for direct use? And then can you tell us a little bit of what we know about what the harms may be in secondhand exposure to the aerosol?
Absolutely. Thank you. So a few different responses to this. So in terms of JUUL and the nicotine amounts, JUUL have about 41 milligrams of nicotine per pod. And if you've seen what a pod looks like, they're pretty small. So if you do the math, a lot of people nationally are saying that's about 1 pack of cigarettes. We've actually in our lab done the math to say it's closer to 1.5 to 2 packs of cigarettes worth of nicotine. So it's important, one, to know whether you go 1 or 2 packs, somewhere in there, a JUUL pod is an extremely large amount of nicotine in there. Second, the type of nicotine is different from what you may see in a cigarette. Cigarettes use ammonia-based, and other e-cigarettes use ammonia-based nicotine. JUULs use what's called salt-based, which is basically benzoic acid is put into the e-liquid, into the nicotine mixed with it. And the bottom line is, and why it's so incredibly important to know, is it's highly addictive. It's a mixture with the benzoic acid. The salt-based nicotine goes into the body, gets absorbed much faster and easier. And because of that, and also you get less of the painful throat hit, and you get a lot of positive taste from the flavors. And because of that, young people who are nicotine naive, have never used any other form of tobacco or nicotine, actually wind up liking it more, not as painful, they don't dislike it as much, and the nicotine gets absorbed faster and faster into the brain, so they're more likely to become addicted. Now, we don't have studies on is it 1 pod or 5 pods. We don't know that, but we do know that the formula is such that it will go to the brain faster. In terms of the effects, so nicotine is really harmful to the developing brain. So as adolescents and really young adults up until about age 25, 26, our brains are still developing. That's great. That's cool. Means that young people can learn lots of information, do new things. But along with that, the brain is looking for cues of what they can and cannot shed away, because our brain goes through a pruning time where our brain gets rid of pieces and connections, neuronal connections that we don't need anymore. So in that process, anything you introduce into the brain, your brain says, great, I'm going to keep that and be interested in that substance. So you introduce nicotine and the brain says, great, I was waiting to see if there was some reason for these nicotinic receptors. You give me nicotine. Now that I have it and I'm under 25, I'm going to be able to develop and keep up the nicotine receptors and be able to become more addicted. It's a little complicated, but the short is you're just much more likely to become addicted as an adolescent and a young adult. So it really harms and it actually physically changes the brain. The other thing is during adolescence, and if you are addicted, you're more likely to be moody, to be emotional, and I know adolescents are that way anyway, to be even more so. And we've seen youth not even be able to sit still for an entire period of class, and others on the panel would probably know that from sitting in classes. So that's part of the thing. The other thing is we know from the flavors, which all have diacetyl, a buttery flavor, or vanillin, or cinnamonaldehyde. The flavors that are in these, all e-cigarettes, and including JUUL, is harmful to your lungs. And we're seeing more and more reports of young people coming in with asthma, pneumonia, respiratory illness, and other effects just simply because of the flavors. And then we know we don't have very good long-term studies, but we do know that just the that heart and lungs can be affected from e-cigarettes. So we've got everything from the short-term brain development all the way up to the long-term or medium-term of cardiovascular and lung disease.
Great. So that's a good sort of overview of the science of nicotine and its potential impact on adolescents and their brain health, which, I think is just so important for those of us who are public health and educational professionals coming at this. I mean, as much as we can speak to the science and to what we know to be true, we're much more effective then. But I'm curious, Haley, when you talk to your peers about JUUL use and, what the potential impact or risks are of using JUUL. What do you focus on? What do you find are the messages that are most effective?
Yeah, that's a good question. So something I've been doing presentations like this for a couple of years now, and I've kind of learned a lot throughout the years, and something that I've kind of narrowed it down to is it's really all about your approach and how you really present to your peers, and how you really present your information. I think if you go into a situation with the goal of getting everyone in the room to quit tobacco or to quit e-cigarette use, that's not realistic, and it's probably not going to happen. One thing that I always try to say in my presentations right when I start off is that I'm not here to judge you. I'm not here to convince you to make different decisions. All I'm trying to do is educate you and inform you about the facts and the true facts and information about e-cigarettes and tobacco, and to inform you about how the tobacco industry is really manipulating you into getting hooked on these products. And I found that having that approach is just really a lot, makes the presentation go a lot better, because the youth are not feeling judged. And you know, especially when when you're a youth and when you're a peer and you're talking to your peers, that you really have to be careful with how you talk to them, because they don't want to be talked down to. They want to be talked with and alongside. And I also think that that encourages the conversation. I think you also don't want to go into a presentation with a set script of how you want to go, because I think it's truly all about the conversation. And so one thing that I always do is I always ask them, what have you guys seen? What is your personal, you know, what have you seen in your school or in your community or among your friends? Once they tell me that, then I kind of create my presentation to kind of adjust to that. So we're kind of just having a conversation rather than me presenting like a 45-minute presentation to them, because that's not really going to be effective at all. So those kind of having that tone in my presentation I found has been kind of the most helpful, but then also having something that's interactive. If you give a 45-minute presentation with a bunch of words on a screen, kids are not going to get anything out of it. You have to have something that is interactive, it's fun, and that they really can relate to. And so I've used in all my presentations that I've given to youth is the Taking Down Tobacco curriculum, and I find that is an amazing resource because it's interactive, it's engaging, and it's something that youth really can relate to and can really get engaged from. It's something that they really like to listen to and can find beneficial. And so I found that those types of resources and having that type of tone in my presentations have really been effective.
That's great. Thank you. That's very useful insight from somebody who is kind of on the ground talking to people. We've got just a couple more minutes left that we've allocated for this this section. So Sally or Rick, you have any other thoughts about how we message well about the health harms of nicotine? What are the most effective ways to do that? Sally, you have anything?
We have a young person in North Carolina who's been doing a bit of public speaking about his story. And I think, like Haley says, hearing the stories of the kids who've been through this, he really suffered pretty serious consequences in terms of his schoolwork, in terms of his health. And he's focusing on messages about more positive alternative strategies to deal with the stress in high school. And it seems to be having a good impact on his peers. So I compliment Haley on her strategy. We're seeing that work with some leaders like her in North Carolina as well.
Great. And Rick, anything to close us out on how to message about this in this population?
I would just echo the importance of having students talk to students. Kids spend, I'll say senior in high school has spent 13 years listening to adults tell them what's right and what's wrong. And as adults, we tend to follow the script. And for Haley to break information down to kids talking about kids, that's really where the win is. It's our kids that are the future, and they control that. We don't want to reach a point where they've heard the same message. It's like talking about bloodborne pathogens to adults. Being an HR director, I can put that on the table. You mentioned bloodborne pathogens. You can just watch people's eyes roll back in their head, and I'm sure people listening are doing that right now. And the reality is you have to find people that can deliver the message in a way that the audience hears and understands what they're trying to communicate, rather than getting lost in a lot of jargon and statistics that may not be nearly as new as what we've already heard in this presentation, which is wonderful. There's nothing worse than saying, well, in 2016, here's what we knew. We need to have relevant information that's current and appropriate for the conversation at hand.
Great, thank you very much. And I'm getting a text from some of the comments we're getting online asking, Haley, could you repeat the name of the resource that you shared just now when you were talking about a resource you used that really helped you with communication?
Yes, it's Taking Down Tobacco, and it's an online curriculum in partnership with the Campaign for Tobacco-Free Kids and the CVS Health Foundation. I believe the link was put in the group chat. If it is not, I can definitely would be willing to share that resource, but it's completely free and it's online, and it's something that teachers can use in their classrooms, or you can use to give presentations, whether you work at a health department or you're a youth yourself.
Great. Thanks very much. And yeah, we are monitoring the questions and what's coming in comments over the call. And it may be certainly fine if some of our speakers, if they see something they think they want to speak to, they can incorporate that when we're going through some of the other areas. So we're going to transition now into our second section of this call, where we're really going to try to talk a little bit about what are some of the interventions we can use. What are some of the things that we can prevent youth from initiating use of electronic cigarettes, and particularly JUUL, or how we can reduce their access to some of these new and very enticing delivery systems for nicotine. So I'd like to, we're going to hear a little bit from everybody on the panel here. We're going to start on the next question again with Sally. Sally, can you tell us a little bit about, what, from your perspective, what can schools, community members, and parents do to help prevent youth vaping at the community level? And what are some early indicators that you've seen of what's working and also of what's not working?
It's a great question, Marcus. And reflecting the question, I think one of the things that we're trying to say in North Carolina is this epidemic is everyone's responsibility. And much like Rick said in his opening remarks, I want to thank Bonnie. The first time I presented to pediatricians a couple of years ago about this problem, I held up a JUUL and said, does anybody know what this is? And the pediatricians had no idea. And I said, how many of you have kids in school? Go ask them. And I got so many email messages back. Oh my gosh, Sally, I'm so glad you tuned us into this. And what I recommended at the time was the Stanford Tobacco Toolkit. And we really worked hard the first year on educating adult influencers of youth. So folks like Rick, school personnel, parents, teachers, and pediatricians. And now we're getting into working a little bit more with young people. And to take a step back, I want to also say that in tobacco control, we've been working on this for a long time. We have more data about what works than almost any public health problem. And I want to point to one of my favorite graphics, tobacco control, the tobacco control vaccine that was published a little while ago, and you'll get this in your meeting materials, that really, we know what works: tobacco price increases, smoke-free and tobacco-free policies, easy access to tobacco treatment and cessation, and hard-hitting media campaigns. And I would add to the hard-hitting media campaigns, hard-hitting and helpful media campaigns that are interspersed during the year. So those are all things that I think are really important. Specifically in North Carolina, the timing of this webinar is great because we've just updated our strategies for tobacco-free schools compliance, and that's one of the handouts you'll get by attending this webinar. And we're really working closely with what we're learning from school faculty in North Carolina to provide information about the Stanford Toolkit to help educate adult influencers. But curricula like Catch My Breath, which is really being adopted by many schools across North Carolina to prevent tobacco use initiation. And programs like Aspire that can stand in as an alternative to suspension. We really are beginning to get some data that punishing kids and sending them, especially out of school where they can get into more trouble, is not the most helpful thing. as you heard from Bonnie, kids who are using these products are getting quickly and easily addicted because of the flavors and the high nicotine levels and nicotine salts. So we need to provide tobacco treatment to those kids that are finding themselves addicted to nicotine.
Great. And, you know, we know that social media and other technology are such powerful modalities now, and particularly powerful and frequently used by youth. Dr. Halpern Felcher, can you tell us a little bit about what the research says about what kinds of use of social media and other technologies are particularly effective in preventing youth use and access to JUUL products?
Of course. So what we're really seeing right now is that if you've looked, there's a number of social media ads. So youth are not so much learning about these various tobacco products, e-cigarettes, including JUULs, through the traditional channels of TV ads, although there are some, and unfortunately it's not illegal right now to have those ads, or through newspapers, but they're really learning about it through social media, and they're being texted and they're being influenced by the use of these. But thankfully we also have some various texting and other technologies to help prevent youth. So one is the Truth Initiative. I can put it on if we don't have it. It has a new texting message application that can be used by youth across the country. There's another one through the National Jewish Health Organization that's available in certain states. I am around that, and I actually helped develop and consult on that and really help teach the coaches. So the coaches have been trained through motivational interviewing and other technologies and on developmental psychology and youth development. So they're well trained in being able to talk to youth to help prevent. So those are the two social media and texting or technology apps we have to help prevent youth, or really more than prevent, also to help stop youth who are already using, because unfortunately we don't have any FDA approved nicotine replacement therapies. So this tends to be the way that we do it, is through these other sources. The other thing I do want to mention, and I put it through on the text, is we do have the, and Sally, thank you for the huge shout out, the Tobacco Prevention Toolkit. It's just tobaccopreventiontoolkit.stanford.edu. This is a free online set of curriculums available to all parents, all educators, all healthcare providers, and youth themselves, that has an enormous amount of information on not only e-cigarettes, pods, JUUL, but also on nicotine and the effects of nicotine on the brain. And it has a lot of interactive activities and PowerPoints that you're welcome to use, as long as you're not the tobacco industry, that you're welcome to use and pretty much use as you wish. We also do come out and do free trainings if you're interested in learning how to use the toolkit better. And Sally, just so you know, we do have an alternative to suspension program coming out at the end of the summer. So we'll have a particular part of the toolkit available there to really help schools interact and deal with or do secondary prevention with youth who are using. So those are some of the resources that we have so far that are both to prevent and to stop those who are already addicted.
That's great. Thanks a lot. I want to go to Rick now and just ask you, Rick, a little bit more about the school environment and how you're coming at this, particularly using the kind of tools and approaches that you all have learned are effective in these populations. You know, what have you seen has been effective in addressing, particularly when you have a school policy, you know, what do you do when people are violating it? And how do you do that so that you don't end up with the unintended consequences like increased absence from school, which isn't a good thing either. I mean, when we tell people they can't go to school because they're not following the rules, you know, the downside is then we start to lose. Tell us a little bit about how you've approached that.
Yeah, well, what we know is that consequences have the lowest effect size in change in behavior. And we can pass policies all day long. You know, we've had an e-cig policy in our list of policies for many years. JUUL already falls into that category, so we don't have to do anything different with our policies to make this a big issue. The reality is taking the negative consequence approach won't make it any better. And so our strategy more has been, as Haley has discussed, it's hand to hand, it's teacher by teacher, it's kid by kid, it's It's getting more kids to know about the harmful effects, because when you empower kids to make better decisions and choices, they will lead the way. And as adults, you're right. We have to put up barriers and we have to put up boundaries and give opportunities for kids to know when you hit a wall that there is a consequence for doing that. We never can get rid of consequences. We just have to know that the consequence itself won't encourage a student to make better choices in the future. If that was the case, we would eliminate all speeding laws across our country because people know speeding is illegal. Well, it happens anyway. Same thing with any other negative, harmful items such as marijuana or alcohol. We've had policies against those for many years as well. And so it becomes an education, it becomes a cultural thing. And I'm gonna go back to something I mentioned earlier. If we're not asking students why they're engaging in these behaviors, they'll just replace the behavior with something else. If we tell them JUUL is bad and we do everything we can to eliminate the JUUL issue, yet a student still has an issue they're bringing with them to school every day, they'll find something else. I mean, that's where huffing came from. That's where sniffing glue came from. So we don't want to miss the boat by saying you address the issue and you provide all the structure behind it. But if we're not talking to kids about what causes them to make poor behavior choices, we'll be having this same webinar a year from now, and we'll be talking about things that aren't yet on our radar at that point in time. So we have a lot of work to do in terms of engaging with kids at the kid level about issues that are real to them, not about history or math or science. It's about survival. It's about coming to school every day and feeling like they're valued and important.
Great, thank you. Yeah, that really, it's good to get that perspective because you've clearly had a lot of experience and sort of understanding what motivates kids and what demotivates them. So while we're going to segue now into a little bit more discussion about policy language and policy implementation around this particular issue, and that policy is such an important component of the work that we do in tobacco control. I wondered if we could start off, Haley, if you could just review again for us, what your school's policy is and what considerations were made to consider elements like enforcement without disrupting the learning environment and other things. If you could just, I know we've talked about that some, but maybe if you could just reiterate what exactly the policy is and how you came to it.
Yeah, so like Rick said, I mean, I don't know the specific language of our policy. However, I do know that no tobacco or electronic nicotine device is allowed on campus, in school vehicles, at school-sponsored events, or on any type of school property. And so that pretty much covers everything when it comes to what we could improve in our policy. It pretty much encompasses everything. However, when it came to what I was trying to do within my school, I'll go back to the whole approach thing. I approached my, Rick was the first one that I approached, but then I went to my building principal, and I didn't want to I was really careful with how I worded my words because I didn't want to come across as, hey, I want you to do this, or I want you to pass this, or I didn't want to tell him how to do his job because that wasn't my place. All I wanted to really focus on was how I can help my peers and how I can help his staff and my teachers be educated about this product. And that was really what I kind of went from how I kind of approached the situation and how I've kind of did throughout the year.
That's great. Let's talk a little bit more about some of the other aspects of policy in different places that can be influential. Maybe we'll start this one with Sally. We've talked about policies in schools. Sally, can you talk a little bit about some of the ways that healthcare providers can influence this issue through policy, or particularly can influence school policies on a JUUL or other products?
Thanks, Marcus. Yes, in North Carolina, we work on a whole school, whole child, whole community approach to healthy behaviors among our young people. And that really means that we need connections between school policy and school personnel, such as school nurses, with local pediatricians. Some of the things that have been really helpful in North Carolina coming from the medical community is to have experts, like we have here on the panel, providing letters to the editor and support for evidence-based tobacco treatment services as well as policies, and having that come, for example, from a high-level medical official in the local hospital is very effective in terms of getting to decision makers that can make the change. So having that whole child, whole school, whole community approach, where everybody recognizes that this is not just a school problem, it's not just a student problem, but it is a community problem, and that we really put into place things that we know work, evidence-based policies, and providing effective and supportive treatment for people who are addicted.
That's great. Thank you, Sally. We're going to move on now and talk a little bit more about some youth-specific cessation interventions. You know, we've talked a little bit about the landscape of the products that we're finding in school settings and some of the opportunities to prevent access through policy. I thought we'd talk a little bit now about some of the cessation resources that are out there to support youth and support youth addiction. And so we start with Dr. Halpern Felcher. Can you tell us a little bit, you know, what do we know about youth vaping cessation treatment programs? You know, what works, what are the opportunities to expand some of our research in this area? And ultimately, are there any harms to these kinds of programs or approaches?
And I apologize. Can you ask that last question? I was having trouble with my mute button, but I'm back.
Good. No, we're glad.
Sorry. Yeah,
I know there's been some technical things going on in the background, and I'm sorry if we've got a little distracted. But yeah, so I was just asking you to talk a little bit about youth vaping cessation treatment program. So really moving now out of the whole prevention, but you know, what do we do to help people who do have addiction? You know, what works, and then, you know, particularly what are some of the things where you'd really like to see us able to expand some of our research in this area?
Absolutely. No, it's a great question. I preemptively mentioned a couple of those, so let me say them again. So one of the big areas that we do need research on and policy is on nicotine replacement therapies. We currently don't have any FDA-approved nicotine replacement therapies, drug biologics for adolescents, for anybody under 18. The FDA is aware of this, and there have been numerous talks to the FDA, but studies have now come through and they're not approved. So we really need to encourage those studies and encourage that approval to happen. Still, regardless of approval, a lot of adolescent medicine physicians and addiction physicians are prescribing nicotine replacement therapy, but we don't even have good research to know to what extent it's effective. So instead, we do have those texting and it was posted on the chat, which is great. The Truth Initiative is Quitline, which is showing looking to be effective, and then the National Jewish Health Quitline that I just put on the chat some information. So those are coming through, which has been very helpful and seem to be reaching large numbers of people. Those are the main things that we have right now. We do know youth are very addicted to JUUL and other e-cigarette products, and unfortunately, some parents have had to resort to actually putting their sons or daughters into treatment facilities for days on end, which is just very frustrating to hear, but we are hearing stories of that happening all the time. So if you can know that a young person is using early, and you can do alternative to suspension or secondary prevention. And if that's not working, try these texting lines. And if that's not, and certainly work with your healthcare provider. And then there are the more longer-term treatment facilities if that is needed.
That's great. Thank you very much. We're going to close out this section on interventions by having our panelists talk a little bit about how we reach some of the youth and some of the populations that, you know, often are harder to reach for various reasons. I mean, we have, you know, we live in such a diverse society, and we have kids in schools that are coming from all kinds of traditional and non-traditional family backgrounds and wide range of racial, ethnic, religious, all kinds of different backgrounds and approaches and attitudes about things like tobacco use and and use of all kinds of substances. So one of the challenges is, how do we have messages that really have breadth in who they reach, or how do we begin to develop messages that are very specific to some of the youth who may be more challenging to reach for a variety of reasons. So I'd like to start maybe by asking Rick again about this. Maybe just start with, when you're talking to school administrators, and also when you're trying to educate parents about some of the effective strategies around communicating the harms of JUULs, what are some of the messages you use that you feel like are far-reaching, or are there any specific messages that you have found that you turn to that are specific to kids who may be coming from backgrounds where communication is going to be a little different?
Well, most parents believe that the issue lies with everybody else's kids. And you have to first make it real so they understand how simple this is. One of the things that Haley did, when Haley connected with other superintendents in our county, she brought with her a JUUL, and which looks like a flash drive. And as a part of her conversation, she passed that around, which all of a sudden, you take a group of superintendents who are just now hearing about what a JUUL is all about, and they see how easy this can be concealed. They become a lot more aware of how big the issue is. And so I think when you approach any group, you have to make them understand that this is not something that is so blatantly obvious. You're going to notice it when someone's walking down the street. So you have to approach it from the standpoint of, this is something that is very easily concealed. It's not anything you're going to see or smell. Haley in her conversations talks about the simplicity that you can mask the smell. Simply coughing into your shirt after you vape will largely disperse any scent or aroma that a teacher at the front of the classroom might possibly pick up. And so once you talk to people about how easy it is to conceal, and how parents then become more aware of the idea that a student could do that, or a child could do this in their own home without them even knowing it, their sense of alarm might go up. And it's you have to take the broadest approach you can. And one of the things that Helen and I worked on a year ago was her communication plan. And so we worked out talking to area superintendents. We got a spot on the radio for her. We made contact with a local newspaper. We reached out to our middle schools, because if you wait until high school, for a lot of students, you're already too late. And as kids mature at a much younger age and the challenges they face become real to them at a younger age, if you wait until high school to make this an issue, you've missed an opportunity with a lot of kids to prevent them from actually going down this road to begin with. And so the message itself has to be simple, and it has to be straightforward, and it has to be short. No one wants to listen to 45 minutes. They need 5 really good minutes of why this is important to me, and how I can convince you it could be your child. And it's a hard conversation to have. We talked about parents and the fact that their kids may be engaging in behaviors that are harmful without them even knowing it.
Excellent. Yeah, thank you. That's great perspective. And you are right. Everybody thinks it's kind of human nature that we think the problem is always somebody else's problem and not our own. Sally, you've spent a lot of time in your career on tobacco control, but also, really on being very sensitive to some of the disparities we see. Do you have any thoughts as we engage in this issue of JUUL and other ends products? What are some things we can do, or what are some ways we can tailor our messaging so we don't end up with yet another area where we see significant disparities in use, based on socioeconomic status, based on race, based on ethnicity? Do you have any perspective about how we handle those communications?
A couple of things we haven't talked about yet is there is a movement across the country to adopt policies that move the minimum age to 21. And the thing that's appealing to me about this idea is that it will help reduce the social sources of JUUL and other tobacco products in the school, because kids in high school have access to people who are 18 but have less access within their social groups of people who are 21. Now, I say that, but I also know that an effective tobacco 21 law must be enforceable, and some of the laws that are being passed are not fully enforceable. So it's really important to get down into the details about that. I'll also share one of the ideas that I have. I'd love to hear Rick's thoughts about this, and Bonnie's and Paley's. We have a program that's been very effective in working on the opioid problem in North Carolina, where we have Operation Medicine Drop, and we're working with a poison control center and local public health. Excess medicines can be dropped off and safely disposed of. And with all of the confiscated e-cigarettes that we've gotten just from the 2 studies we've done in schools, there's an enormous amount of e-cigarettes and e-liquids that shouldn't just be flushed down the drain or flushed down the toilet for the sake of the environmentalists. So one of our local health directors said, let's do this in North Carolina. Let's call it toxic take back, and let's include the ability for schools to get rid of their e-liquids and their e-cigarette products that are taken back from kids and dispose of them safely so they won't hurt the environment.
That's a great point, and actually it was a question further back that we didn't get to because of time. But I would be curious at least to hear, Rick, if you do have somebody who's not following the policies and end up confiscating either a JUUL or another product, what do you do with any of these products that you might confiscate from a?
Well, we are fortunate that we have a school resource officer at Hutchinson High School, and he takes possession of anything that is illegal, and it goes to wherever school resource officers take things that are illegal in schools. I can't speak to how they dispose of contraband or anything like that. I think I like the idea that Sally talked about in terms of tying JUULs and opioids. There's a lot of things out there that are harmful. And we're in the middle also of an opioid campaign and trying to figure out how do we give people opportunities to get rid of things that they don't need any longer. And then I think the more that we can couple messages together, I think it's in everybody's benefit, because one commercial is on the don't do opioids. The next commercial is, well, JUULs are not good. And I think people get tired of hearing some of the same stuff over and over. And so I like the idea of pulling some of these initiatives together in one massive campaign to try to reach as many people as we can at one time.
Excellent. So we're going to move into the third section of our teleconference this afternoon, where we're going to talk a little bit briefly about tobacco industry tactics, which are very important, and how we might take some of those on and counter them. And then we're going to switch into a little more of a discussion of some of the approaches that we should be thinking about as we move forward with this epidemic, really, of electronic tobacco product use, and particularly of JUUL and all the other things that are emerging. I'd like to take a couple of minutes to talk about a little more about marketing. We can't ignore the influence of marketing and how it's contributed to this growing epidemic. I mean, it's clearly the thing that the industry has been so facile with. So I'd like to ask Haley to comment on this. We did talk a little bit about social media platforms earlier, but Haley, do you have any thought about how we can use social media platforms or other media to counter, what we know are the industry marketing strategies, and what we know are the things that they are seeing as so effective as far as making these products very appealing?
Yeah, so I know JUUL is all across social media, whether that's people advocating for the device, or whether people are just posting short little clip bits of different types of them using the product. However, when it comes to how we can kind of combat that, I think there's a couple different ways, but I definitely don't know, the right way to do that. One thing is, I know we share a lot of Truth initiatives, does a lot of really good video resources that are very engaging, very short, and really get to the point, that can kind of really get youth kind of interested in what they have to talk about. And I think that they do a really good job in producing those types of materials. And so I've seen those, across whether that's Spotify, which is a music app, or whether that's, on Snapchat. I've seen those frequently used, and I think those are really good resources that are out right now. And I think that just sharing those types of information would be very productive. As for, other ideas for how you can kind of combat the role that social media plays, I think it's really just comes down to educating, and comes down to the whole approach that you have when it comes to talking to youth. I think that you just kind of have to get that figured out until the social media thing goes away.
Right. Yeah, that's excellent. It really is a powerful, powerful thing that we should learn to use to our favor as well. We're going to move now. We're going to mix things up a little bit, and we're going to move into a section where we're going to do what we're calling some rapid fire questions. And so, we got so many excellent questions from participants when they registered that we wanted to try to include some of those, with fairly quick format, with hopefully fairly quick responses from our panelists. And so we've picked a few that we're going to use to mix it up a little bit and get us thinking a little more broadly about this issue and how we disrupt the use of JUUL and other end products. So I'm gonna ask each of the panelists a rapid fire question, and then right now our team is going to text me maybe a few of the comments or questions that have come up online as we've been going through this session. And we'll see if we can get through those. We've probably got about 10 minutes for this, so I'm going to try to be quick with the answers to each one. I'm going to start off with a question for Sally. Sally, what do you think? What are some of the demographic characteristics of JUUL users that are most interesting to you, that really differ from what you've seen in combustible cigarette users?
One of the things we're doing in North Carolina that's really interesting is working with the rescue agency to not just look at typical demographics, but to try to look at demographics by the way peers define themselves. And they are helping us with adding something to our National Youth Tobacco Survey, where we will categorize kids in schools according to their peer group, their predominant peer group, and then their other peer groups. And across the nation, with the work that Rescue has done, they're finding that most of the peer groups are using e-cigarettes. It's more predominant in some than in others. And we had limited resources in North Carolina. We chose to work with the peer group that identifies with rural values, country values, because they're at high risk, not only for e-cigarette use, but cigarette use and spit tobacco use. And we found that the campaign that really began to brand the messages in a way that is sympathetic to the values of this peer group are more effective than just sending out messages in a general way. So we're looking for resources to continue that campaign and expand it into other peer groups. They are beginning to do messaging related to e-cigarettes that will be tailored to each of the peer groups' values.
Excellent, thanks, Sally. Haley, what are the three most important things that you think a student leader can do to be effective in promoting these efforts to stem the use of JUUL?
Yeah, I mean, I can't speak for other people, but for myself, I would say to answer your question, I think you really just have to be real with your audience. Kids are really good at telling if you care about what you're talking about, or if you're just kind of being fake, or if you're forced to be there. And so I really think, passion is definitely what gets me through my presentation, and are the reason why I like to, advocate for tobacco prevention. And so I really think that having just that is a really big factor as well. I think somebody had mentioned or asked a question about a personal story, and I think that's really key to any type of presentation. If you can share your personal story and really tell your audience why you care about the issue that you do, you'll immediately grab their attention. And I find I always share my personal story, and I find that after I do that, I have all eyes on me. Everyone's engaged. They're leaning forward. They're asking questions. So that is a really positive benefit that I think if you have a story that you're willing to share and comfortable sharing, that you should do. So I think I answered your question.
Great. Yeah, no, that was perfect. Rick, are schools finding that JUUL is being used in combination with other substances like nicotine? No, I'm sorry, in combination with the nicotine and other substances. So are we seeing JUUL get used to mix up other stuff in there like marijuana or THC or other things? Can you tell us a little bit about the experience with that?
Yeah, I don't think we have enough data yet to tell you whether it's an intentional use or not. I think our concern would more be it's a precursor to other more harmful things. You talk about using it with marijuana later or THC or other things that you start use. Same thing with cigarettes. You know, a student starts smoking cigarettes and they're more likely, the research says, to become an addict of something else down the road. And you know, I think the value that others might see, others being those that are not using it for good reasons, and I talked about the flavors, you know, the trendy flavors. JUUL has done a wonderful job of marketing something that is brand new for everybody. You know, cigarettes essentially, and I'm not a smoker, but I think they all pretty much taste the same. Well, JUUL's broken through that barrier completely. And so there's an appeal to students now that there are these trendy flavors that, you know, so in addition to the buzz they might get, it also tastes pretty darn good, you know, and then it gives a much higher level of sensation. And so I think if students are doing other harmful things at the same time, what the JUUL brings is a pleasing sensation that they have not seen when they have done other things that aren't good for them either.
Excellent, thanks. That's helpful to hear a little bit about what your experience has been with other substances. Bonnie, you know, you've had a lot of experience around tobacco control, but you've also had a lot of experience doing research in how to stem other risk behaviors. So tell us a little bit about, you know, what can we learn as far as preventing or quitting JUUL use based on what we've learned in other areas, like how we get youth to reduce screen time or how we get youth to reduce their risk of being exposed to sexually transmitted diseases, or choose whatever you want as far as risk behavior. But are there some other approaches to risk behaviors that have been effective that you think we could also use in our work against JUUL?
Absolutely. Well, I think probably the most effective is what we've learned through the Truth Initiative, the Truth Campaign, which is not using scare tactics, being honest with youth, and really talk about how JUUL has really targeted young people. And we know this, people have talked about it already on this webinar. We know it from our research and others that youth are absolutely being targeted through ads, through social media, through flavors, through tricks, through dishonesty. And then we just heard from somebody said it on the chat box, we were going back and forth in terms of at the JUUL hearing, how we know that JUUL went into schools to actually so-called prevent use, while we actually know what they were doing was encouraging use. And we've seen it with our own. We know that JUUL actually took parts of our toolkit and changed it in a way to serve their purposes without being honest about what they were using in order to try to encourage kids to use. So best approaches is to say, look, young people, you're being encouraged, you're being duped, you're being manipulated. Is that really what you want to be happening? They're just Big Tobacco 2.0. Most youth don't want to be involved in cigarettes. So if you try to say how much JUULs are related to cigarettes, 1.5 to 2 packs, we have a really great slide showing that you can message me, anybody, I can get it to you. That could be a poster. That's the best way. Second is to be honest and say, look, flavors, are those really for us? Adults, or are those for you kids? That's the way to do it. Scare tactics don't work, but honest information about the harms and about the flavorants, and again, linking them to cigarettes, tends to be the most effective.
Excellent, thanks. I think we've got time for one or two more rapid fire questions. And so I'm now gonna pull some questions that we've gotten submitted online. And I wanna start with one that I think is a really good area of discussion for us. Rick, I think I'm gonna ask you to respond to this first. You know, we talked earlier about school health nurses and the important role that they play and the nice bridge that they play between health and traditional health and public health and education. But the question is, you know, understanding the most appropriate and helpful role for school nurses in actually addressing nicotine addiction and particularly from the perspective of, you know, what can they do that's within their authority or within their scope of practice. And I know that varies from state and jurisdictions, but, you know, Rick, I just wonder if you had any thoughts about that particular role of school nurses and the issue of helping people with addiction or helping people seek treatment for addiction.
Yeah, sure. You know, anytime you can help a student move forward is based solely on your ability to build that relationship. And as Haley talked about, once people know that you care, their desire to give you their attention goes up dramatically. And our school nurses are, again, as I mentioned before, on that front line of defense where students will come to them with a particular issue that they need to see the nurse for. It could be specifically health related. And through the course of a conversation, a nurse can build a relationship in a pretty quick or short period of time that allows them to dig a little bit deeper into perhaps some things that kids or that particular student is doing that may be putting them at some kind of at risk. And the more that we can equip our nurses to have those conversations and know what are the right questions to ask. Some people inherently build relationships without having to think twice about it. Others rely more on perhaps what might be some scripted questions that we could give our nurses about what they feel comfortable asking. The student can always choose not to answer. There's no harm in that. But the reality is our nurses, when they're equipped to be able to react to students when they come to them with concerns, can perhaps open up a lot of doors to healing that would not have been there otherwise.
Excellent. Thank you very much for your perspective on that. So we're going to now move into a section where we're going to take a few minutes to talk a little bit about, you know, the partnership that we're sort of witnessing here on this teleconference, the partnership that really we've been working on for the last few decades between public health and public health departments and schools and departments of public instruction in our states and our local communities. So maybe I'll start with you again, Rick. You know, give us your perspective. How can health departments best engage school administrators and vice versa on this and other issues? And, you know, what have you seen that's been effective? You know, what kind of engagement have you experienced that's been, you know, particularly appealing to you, or you know, what kind of engagement have you maybe seen that's really put you off? Tell us a little bit about your experience with working with public health on some of these issues.
Well, our health department in Rio County is outstanding. You know, they are the reason that Haley is sitting with us, or that I'm with you today, is because we have a great partnership with the Rio County Health Department. The reality is, you know, we could deliver a message, but we don't have the time to create the message. You know, we don't have the same opportunity at the resource that the health department does to know what does the latest research say, what is the current trends in terms of use, what does the data say, and the health department has that coming to them all the time, and they're better able to equip us with the message when we work in partnership to have regular conversations about what's going on in the community. You know, something may happen at Hutchinson that could trigger a quick spike just because of something that is traumatically impacting a lot of people, a plant closing or other like a weather disaster. And our ability to work with the health department just makes us that much more agile. There's no question that schools have the biggest ear. We are the quickest intervention to reach kids in the shortest amount of time. What we need are the resources to help us know what that message needs to be. And so if a school district does not have a good relationship with their health department, there's two entities that are not working together that are probably paddling the same boat but going opposite directions.
That's great. And Sally, sort of coming from the other side of the partnership, what are some of your thoughts about what works and what are the best ways for these two cultures that, you know, are often focused on slightly different things? What's the best way for them to come together?
It's absolutely critical to work in partnership, not only with school personnel and school decision makers who are so influential in young people's lives, but also with the young people themselves. I'm very impressed with what Haley is doing. I really believe in the power of engaging and empowering youth. I have experienced policy successes, not when I've gone before a school board, but when young people have gone before a school board and asked for something, because it impacts them, and the decision makers are much more likely to listen to well-informed, empowered young people than they are to listen to somebody from government. So thanks, Paley, for all you're doing.
Yeah, no, that really is very important. We're much more effective when we can engage the people that we're trying to work with. So we've now got about 10 minutes left. We're going to use about 5 of that just to hear one more time from each of our panelists, with any kind of key takeaway point that, you'd really like all of us to think about as we go forward and think about the best ways to be effective in our work to prevent youth access to JUUL in school settings. Sally, since you just spoke, I'll give you a little rest. I'll come back to you in just a minute. We're going to start with Haley. Haley, any takeaways or final messages you want to leave with our group?
Yeah, I mean, I mentioned this like 3 different times, but it's definitely something that I think is crucial to just tobacco prevention, e-cig prevention. It's all about your approach, and I think it's really narrows down to that one-on-one conversation. Building that relationship is really crucial because kids do care. Kids want to hear what you have to say, but they want to know that you care about them too. And I think if you can really show that in your presentation and that you can really be intentional with that, that is really what's key to really sharing your message and really being effective.
Great. Dr. Halpern, Felcher, what takeaways or final points or anything you didn't get a chance to mention in the call so far?
Sure. Thank you. Thank you, everybody, for hanging in there. I echo everything that everybody said. I would say for everybody on the webinar, stay involved. Like we were saying before, so many new products are coming on the market, so many new advocacy options for JUUL. If you're interested in getting involved in prevention, cessation, or just advocacy, just stay involved, because I've given so many webinars and talks to healthcare providers and others who one person last week said, boy, we've been in a coma for 2 years. Stay involved and join people on social media so that way you can stay involved and be helpful in all of our efforts, and use the resources that you have at your fingertips today. Thank you.
Great. Rick, your thoughts, your takeaway? Sure.
I think people need to make sure they're purposeful in developing whatever their campaign might be. You need to build that solid foundation. Anything it's so important. We want to be better tomorrow, but the reality is we're not working for tomorrow. We're working long term, and you need to create your plans. And as you do that, listen to all the voices. Find out why kids are vaping. If you want to eliminate that as an issue, kids will tell you, and then address what that particular issue might be. But again, be purposeful in what your campaign is. Who's the targeted message? What do you want them to know? How many different ways can you communicate that? Take the time necessary to make sure that you put a strategic plan together to move forward with the message about JUULing, so people will hear it over the course of time. One big blast is probably not going to do much good. We like to use the phrase, it's like water on a rock. Over the course of time, a slow drip does a lot more to make an impact on that rock surface than throwing a big bucket of water on all at one time.
Great. No, that's a great metaphor. And Sally, your takeaways or final points?
Yes, this is a really important time for tobacco prevention and control. In this rapidly changing environment, we need to track our data. We need to keep up with what's going on. We need to use this data to continue to empower young people and decision makers to build support for evidence-based policies and programs that we know work. States and communities must take action. We can't wait for the federal government to solve this problem. And we have to make incremental progress without closing any doors on future progress.
Great, thank you. So as the facilitator, I thought I would just make a short comment myself. First of all, it's been great to have such a nice variety of panelists on this teleconference, and I think it's really brought a great range of perspective. I think one of the takeaways that I take from this and that really draws from my career in public health is how important these partnerships are, and particularly this partnership with between public health and school systems, and particularly public school systems, because they serve such a large part of the population we're trying to reach. And you know, it's been great on this call to have a group of people who really, I think, understand the perspective from both sides, and they understand it's nice to hear people from public instruction, and particularly to hear a person who's Haley, a person who's very early in her career, have such a great understanding of some of the health issues, and hopefully be able to take that forward as she continues her work. And then, it's been, I mentioned that I've known Sally for a long time, and I certainly early in my career got a lot of coaching from Sally about how to come at these partnerships with a group that's different from you, and obviously the challenges and the priorities that we have in public health, and those that others have in public instruction and education. I mean, they're very different, and that's something that I guess the big takeaway I have is you've got to be respectful of that. You've got to understand where all of the different partners at the table are coming from, and how this fits into what they're needing to get done and what they're ultimately being judged or evaluated on in the long run. So it's great to see it when it works so well, and it's really worked very well with the participants that we've had on our teleconference this afternoon. So we're going to wrap up now. Again, thank you very much to Bonnie, to Sally, to Haley, to Rick for joining this teleconference and for being so eloquent in the points that you brought us, and in the experience that you bring from really a range of different settings. I'd like to thank the ASTHO staff. There are a lot of people who went into making this conference a success, this experts virtual session a success. And so thank you for getting us so organized. We had a phone call ahead of this that I think really helped me and the speakers to be able to be on task and on point as we went through the virtual session. And then thank all of you for joining us. We had, when I looked, just about 5 or 10 minutes before, we already had 60 people on the line. I think it's probably even more than that. If somebody wants to text me the number, I will say it in just a minute. But thank you for joining. I hope you found it helpful. You will be provided with a link to the recording as soon as it's available, and that should be within the next week or so. If you have any additional questions that you really want some answers to, or that you're sorry it didn't come up, please email our staff at chronicdisease@astho.org. That's chronicdisease@astho.org. After this call, you're going to be directed to a brief evaluation survey at the conclusion of this session. When I was talking earlier about what we're all judged or held accountable for, these evaluation surveys, they hold a lot of weight at ASTHO. So if you could give us your honest feedback, we'd really appreciate it, because we hope we did this well, but we want to make sure we know ways that we can do the next one even better. So if you take a few minutes to share your feedback with us, that'd be very helpful. So I just got a text that there have been almost 300 people on this Ask the Experts virtual session. So that's great. It's obviously a topic that all of us are struggling with, and that all of us are really interested in doing something about. So thank you again for participating, and thank you all of you who were part of producing the call. Thank you for your work, and hope everybody has a great rest of their day. Bye-bye.